Hi, Cara.
Oh, hi, Vanessa.
We're in an interesting moment in our society as people who educate kids and adults and educators about sex and health. We're recording this episode on February 3rd, 2025, a few days after many resources on the CDC website, resources that we rely on and healthcare providers rely on, went dark and were inaccessible on the CDC website. Some of those sources are things like guidance on prescribing contraception, and I'll let you talk more about that. Also, the Youth Risk Behavior Survey, which we've done an entire episode on, is an incredible source of data and information for people like us who care deeply and want to know as much as we can about the behaviors and lives of teens in this country.
I spent Friday night, I don't think you know this, Vanessa. I spent Friday night deep in conversation with Jessica Yellen of News Not Noise. She was doing a speaking event across the country and we had been texting, and I just picked up the phone. You know how you never want to call anyone on Friday night because it's like an admission that you're home doing nothing on Friday night. And we had an hour-long conversation about, is it important even that the CDC doesn't have this information available right now? Can't people get it from other resources? And then the conversation went from there. So I just want to speak to that at the top of this episode for a second and share with you and with all of our listeners what I said to Jessica was my opinion. Vanessa, I'm obviously very interested in your opinion too. But to me, the answer is there are lots of good alternate resources that provide this information. But the CDC is the clearinghouse of all what we consider as a society, as a community, valid scientific and medical information. Like anything, if I Google something and there's a CDC link on page 1 or page 2, that's generally the first link I'll go to. It's a good housekeeping stamp of approval that says the science is believable, it is vetted, it is peer reviewed, and we as a community agree that this is important information to share. So the fact that so much content is being taken down, it is a sign that we are supposed to think that this is not good, valid scientific information, right? That's what it's virtue
Or that
signaling.
other things take priority over good scientific information.
Correct. And I think that's an important thing. Now, Jessica did say one thing to me that I didn't know, and I think was very helpful in reframing my view, although it didn't reframe it that much, but it reframed it a little. So what she said is, oftentimes when administrations change, information is taken down and new information is put up. And while things have been moving at record speed since Trump came into office just a couple of weeks ago, it remains to be seen whether that information is simply down or is down and will be replaced by something else. So I just put that out there as something to chew on as we go through all of this information. The information we're about to present is valid, it's science-based, it's reliable. We will do it in our usual relatable way where we make you laugh and where we make each other smile and occasionally sigh, almost with a little bit of sadness, but most of the time we can have fun with it, because if you can't have fun and you can't smile, it sometimes becomes too painful. But this is true and valid information. And Vanessa, we have all of this information available for people in lots of places. So you want to walk through that for a sec?
Yeah, I mean, we have a huge chapter on contraception in our book. I think it might be the longest chapter. I know it was a long read for you when you did the audiobook.
And for you when you had to edit it. Yeah.
And for me, when I was like, oh my God, this is a lot of information. So there's a huge chapter in our book. There's a lesson in our course, Less Awkward University, on our membership. This is part of a lesson in our 8th grade module in our school-based health and sex ed curriculum. And as we build our high school curriculum, this information will also be in our high school curriculum. Cara's holding up our book. This is so awkward. So we have it in lots of different places, but different people learn differently. We'll also be doing a newsletter about it. You can subscribe to our newsletter at the footer of lessawkward.com, where we'll present this information in yet another way and show a sample of the lesson in our membership in Less Awkward University. So this is one of many ways to get this information. Our responsibility, we believe and view our responsibility to be to get science-based, comprehensible, relatable information to as many people as we possibly can so that adults and the kids they care for can stay healthy and safe.
So with that, let's jump in to a podcast that covers a little bit about pregnancy, because you need to know a little bit about pregnancy before we talk about pregnancy prevention. You ready?
Yeah, let's talk about some sperm and some eggs, Cara.
This is where cue the music. Let's talk about sex, baby. I would sing, but I'll stay on task. Okay, here we go. So for anyone who is not in the know about how pregnancy works, the plea here is to educate yourself. We are going to just do a super top line summary. This is not comprehensive about pregnancy, but there are so many places to get some comprehensive information about pregnancy. And if you're unaware of the anatomy, if the biology of it throws you for a loop, which is totally fair, read up, learn, and be in conversation with other adults before you get into a conversation with a kid who's going to have a lot of questions. Another little side note, if a kid asks you about sex and pregnancy, Vanessa and I have done so many episodes about this, but age where they are in terms of what they want to know. Sometimes they'll ask you about sex, and if they're very young, the question you think they're asking and the question they're really asking are two totally different things. So you can always say that magical question. Vanessa, what's the magical question?
That's so interesting. What made you ask that? And just a hot tip from people who've educated a zillion kids and their families about bodies and sex and puberty. Younger kids are really tending to ask, how are babies made? And older kids are really tending to ask, what is sex? And then there's that age in between, that's sort of like 7, 8, 9, where it could go either way and you're not sure. And you have to kind of figure out their starting point before you go down a ramp. But no matter what, find out what they know. What are they really asking before you unload the information? I mean, we hear from parents who are like, I'm ready. And they rub their hands together and they're like so excited. And then they realize they're answering a question their kids didn't even ask.
Yeah. And that's awkward. So how babies are made? Very simple answer. An egg and a sperm must join. The egg carries half of the DNA. The sperm carries half of the DNA. They each carry one copy of each chromosome. They come together, and now you have 2 copies of each chromosome, which is how the human organism is built, using this blueprint of 2 copies of every chromosome. And that egg-sperm combination then joins to form a single cell, which divides into 2 cells, which divides into 4 cells, and so on and so on. It's like the Wella Balsam commercial. I told 2 friends and they told 2 friends. The important note here, and this is where you really want to educate yourself about how to have these conversations, and we have lots of advice through our hub, is that the one way to make a baby is penile vaginal sex. And what happens is when a penis gets inserted into a vagina and sperm is ejaculated out of the penis, a sperm can swim through the vaginal canal. Vagina is a muscle, just quick note, reminder. Then through the cervix, little hole in the cap at the base of the uterus, then up through the uterus. And this is a fun fact that a lot of people don't know. Most fertilization, where the sperm meets the egg, actually happens in the fallopian tube. So a lot of people think it happens inside the uterus, which is where a fertilized egg will implant and where a pregnancy will grow. But actually, that's not the case. Most fertilization happens in the fallopian tube. There are 2 of them. They come off of the top of the uterus. One goes right, one goes left. And it's the ends of the fallopian tube that have these little fingers, fimbriae, and they kind of reach out to these free floating ovaries, not exactly free floating, but they're separate from the fallopian tubes. And it's like when you ovulate, when a person ovulates, their ovary launches an egg across that little teeny space and into the fallopian tube. And it is in the fallopian tube that's got, I think the diameter is about like a piece of bucatini, we decided in our book.
Yeah.
It's like a
someone said straw,
spaghetti.
but a straw's opening is too big. We feel like it's
big.
the whole of a bucatini.
Yeah, go to the market. It's a bucatini. So the egg is coming into the fallopian tube from one end, and the sperm is coming into the fallopian tube from the other end. And when they meet, and now this is the part of sex education you're going to remember, because there are millions of sperm and more than one are heading towards the egg at any given moment. And it's the first one to be able to penetrate that outer coating on the egg and have the 2 halves of the DNA merge. And now, boom, you have fertilization. In order for that fertilized egg, I love how the egg gets the call out, but not the sperm. It's not fertilized sperm, it's fertilized egg. In order for that fertilized egg to become a viable pregnancy, it must travel down the fallopian tube into the uterus and attach itself to the wall of the uterus, where it will get all of its nutrition and all of its blood support. And so that's called implantation. And that is really where pregnancies take root. That is, just to be really clear, a pregnancy in the fallopian tube, when the fertilized egg implants in the fallopian tube, that's called an ectopic pregnancy. That can be life-threatening to the mother because the egg will grow and grow and grow, and the bucatini cannot accommodate an ever-growing collection of cells, and at a certain point will rupture. So that's what an ectopic pregnancy is. But a fertilized egg that implants in the uterus, that is what we call a pregnancy.
So we're going to talk about contraception. Just to reiterate Kara's point earlier, we want to make sure kids know there are many ways to get a sperm to meet an egg. And many people listening may have made their own children in a variety of ways where a sperm could meet an egg, either outside the body or in the body. And our kids are in classes and in schools with kids whose families were made in all different kinds of ways. So when we talk about talking about sex inclusively, that is one way we talk about sex inclusively, is acknowledging all of the different ways that families can be made. And one way is actually through penile vaginal intercourse, but there's many, many other ways. What we're going to focus on today is penile vaginal intercourse and how to prevent pregnancy when having penile vaginal intercourse. But that's only one narrow swath of the ways people have sex and the ways people make families.
And so we're going to talk about now contraception and pregnancy prevention. But I want to set up this part of the conversation the way that we set it up in our writing, Vanessa, which is there's pregnancy prevention, and then there's STI and STD prevention. STI, sexually transmitted infection, and STD, sexually transmitted disease, when you have symptoms of that infection, those are independent of who is having the sex. So, if you think about it, if you've got two people who are having sex, both of whom make eggs, right? Two females who are having sex, two eggs cannot get each other pregnant. You need an egg and a sperm. But you can absolutely transmit sexually transmitted infections and sexually transmitted diseases independent of that. So when we talk about contraception, remember there are two huge buckets. One is STI, STD prevention, and the other is pregnancy prevention. And this conversation gets really simple, really fast, because there are two ways. There are only two ways to prevent the transmission of STIs.
So one way is just not to have any kind of sex or even kissing in some cases. And do you want to explain why that is, Cara?
Yeah. There are certain infections that can be transmitted through blood, through saliva. So it's essentially if you're an infection and you can get into someone's bloodstream, or you can cross their mucous membrane, which might be in the mouth, in the eye, there's a mucous membrane. Certainly in the vagina, there's a mucous membrane. If you're an infection, you can often get into someone's body that way.
And in terms of saliva, is that because the mucous membrane is being crossed?
Yeah, exactly. So if you think about the inside of your mouth can have cuts. It can have canker sores. It can have, I'd say once a week, I'm eating some food and something inside my mouth feels like, oh, I just burned the roof of my mouth, and the tissue feels different, right? So these are very, very permeable membranes, if you will. The mouth is, it's a good barrier, it's not a great barrier. And so STIs, like herpes, for instance, love to get from one person to another across these mucous membranes, through saliva, across a mucous membrane.
Does the anus have a mucous membrane, or
yes,
is it transferred?
Does.
Okay.
And so there's mucus in the anus, and then also there's a very, very rich blood supply. And if you think about it, here we go down a road you probably didn't anticipate in this conversation, Vanessa, but people who have hemorrhoids, right? What are they? Those are just little teeny tiny blood vessels right near the surface that break because of pressure, and they bleed a lot. So the anus is one place where the reason STIs get transferred there is more because there's often direct entry into the blood supply.
Okay.
Yeah.
And so barriers, right, is both a way to prevent STIs and STDs, and can also be a way to prevent pregnancy. So I guess we should start there. The standard is condoms. What's interesting about our generation is we grew up with the fear of God put in us about HIV and AIDS. We were sex educated in the 1980s and 1990s when, finally the US government was acknowledging that there was a health crisis, and finally they included this information in the sex education that kids across America were getting. And so what did we do? We followed suit, and people used condoms, because unlike today, there was no I don't want to say cure. There was no prevention for HIV. There was no treatment of living with HIV. And there are some people who it's been said that they are cured of HIV. So there was no way to manage it at all. And so we used condoms.
Yeah. I mean, I wrote my junior paper in college about HIV transmission, and it was a very new topic. And Magic Johnson had just come out as being HIV positive. And that was in 1990, 91. I mean, this was a long time ago. And there are people who have been living with their HIV thanks to all sorts of innovations in everything from, medications that keep the virus number in check to, there's a whole science to HIV medicine that's remarkable. But there have been people who have been living with HIV for 35 years, which is really, really incredible. But at the time, Vanessa, you're absolutely right. We were being sex educated from a place of fear. And that was directly associated with condom use. People realized, proving that teenagers actually care and have brains that work. People realized if they wanted to be having sex and they wanted to survive, they should use condoms. And the data on condoms now is very, very interesting. The data on sex in general is really interesting to me because there are all these headlines that people are having less sex, kids are having less sex, teenagers are having less sex. People throw that around all the time. You and I are not 100% convinced because the questions that are being asked aren't super specific. So it's prone to interpretation when those kids are asked, like, well, what is sex? If they're having oral sex but not vaginal sex, what are they answering to these questions? And some of the surveys go into that detail, others do not. So, but we know that condom use is down over time. The only thing other than not engaging in sexual activity that is going to prevent the passage of all the different infections that we cover in the book, and there are a lot of them, are condoms, barriers. And there are condoms for the penis. There are vaginal condoms, which are essentially just sort of barrier sheaths that you can drape over the vaginal opening. And some people call them dental dams. And there are people who use them orally as well because as you said, mouth to mouth intimacy, kissing, et cetera, you can pass an STI. So if you want to be sexually active in any way and you want to guarantee, the closest thing we can give you is a barrier, like a condom, but it's not a guarantee.
Right. So you may be sitting here thinking, well, I know they told us to use dental dams when I was in college, and I don't know anyone who used a dental dam. And we certainly didn't use them when we were just like making out with someone. So we have to be realistic about what kids are actually going to do or not do. And so one recommendation is if you have a kid in your house or kids in your house who you think may be sexually active or are sexually active, then those kids should get tested there's a full panel of STIs and STDs that can be tested for, and those can all be treated. There's certain, for people with penises, they have to pee into a cup for certain things, right, Cara? And other things, it's a blood test. So it's not necessarily, bing, bang, boom. Sorry, that's a terrible phrase to use in this conversation.
But there are lots of ways to collect the sample: urine, swab, blood, and different infections, different tests. Yeah.
And don't assume your kid is going to say, oh, I know, or oh, no, I don't have anything. Or, just like you don't always take their word for it on other things, like they did their homework or they took out the garbage. In this case, their health and safety really depends on you being extra sure and getting them tested so that they can be treated, because STIs can be asymptomatic and there can be real consequences if they're left untreated.
Yeah. And I think it's an important point to note. There's a very large narrative that has been in existence for a very long time that screams, sex doesn't feel as good with a condom. And that narrative has driven a lot of decisions by all people, by guys who don't want to use them, by women who are having sex with these guys who don't want to disappoint them. And I think it's really important to talk about that narrative with the kids in your life when you're talking about condoms. Because the truth is, Vanessa, that the place where this advice falls on deaf ears is when you don't address the elephant in the room. And that is, generally speaking, the elephant in the room. And if you don't talk about it, then it's a false choice, right? The other thing is with pornography and the ubiquity of pornography, what we have seen is a generation of teenagers who are using porn more and more often online, and they are developing erectile dysfunction as a secondary sort of downstream consequence of using porn. And just to connect those dots for you, it's because in order to get stimulated and to have an orgasm, their brain needs increasingly titillating imagery. And what happens is in real life doesn't look like porn. And why do I bring this up now? Because asking a kid who is using a lot of porn to use a condom will often, again, ignore this very important conversation about pleasure and about erectile dysfunction and their ability to perform during sex and the pleasure they get from sex. And it's all super uncomfortable to talk about with your kid, but you got to talk about it with the kids in your life. All of these topics intersect. And I mean, I will say, sitting here with a microphone in front of me, have I done a good job? Have I done it? Yeah, I've done it. Have I done a good enough job? Vanessa, I don't think I have. I don't know how you feel, but I don't think I've connected those dots enough times clearly enough.
I mean, I think these are so many different conversations that happen. It's like, guys who are circumcised have been told that they have less sensation than guys who still have their foreskin, for example, right? There's a lot of information floating around. But since we're talking about contraception, I will also add that a doctor in New York State has been sued by the state of Louisiana for prescribing abortion medication by mail to someone in the state of Louisiana. And I say that as we're talking about contraception because many people have said, as abortion laws have gotten more and more restrictive across the country, well, I can just get on a plane or I can just order pills. Well, we don't know legally if that is actually the case. And contraception prevention, as Loretta Duggan talked about on our podcast a couple of months ago, prevention is the key. That is where we protect ourselves from all sorts of down the road impacts that are becoming more and more complicated in our culture. Condoms is part of it, and other forms of prevention is also part of it. So, Cara, let's dive in to the many forms of contraception, which frankly have evolved and changed a bunch since we were in college.
Vanessa, this is a good moment to just take a second to define the term emergency contraception versus abortion, because it gets confusing and it's not really that confusing. So emergency contraception is medication that people take. It's generally hormones that can even be in the form of oral contraception pills, which we'll talk about in a minute. And they're given at a higher dose, and they prevent the implantation of that fertilized egg. So if you go through at the top, we talked about what is pregnancy. Pregnancy requires a fertilized egg that it has implanted. An emergency contraception prevents the implantation. It prevents the pregnancy. Abortion is the term that describes the ending of a pregnancy. So the pregnancy has established, and then there are medications or surgical procedures that can be done to end that pregnancy. And we talk about it in the book. This is so awkward. We have podcasted about it before. We have written about this, but it's very, very important that people understand that there is a difference. This New York doctor who was charged on the grounds of A, interstate care, which is a huge issue, and B, abortion services. So a pregnancy had been established. But I think you bring up a really important point, which is the starting line keeps moving back further and further. And there is real concern in the medical community that emergency contraception is now on the front lines, and people are going to start challenging that. And it is very different than abortion.
So, Cara, I mean, we grew up in a time where the birth control pill was legal and accessible by prescription, and condoms were sold. Actually, it's funny. I was just talking to my mom about condoms because that's what my family does, is talk about things like condoms over the breakfast table. And she was describing what it was like when she was growing up in the 50s to buy condoms. Now, condoms were legal to be sold, but they were held behind the pharmacist's counter. And you had to ask for them. They were like
Sudafed.
They were like Sudafed, except you can't make meth out of them. And you had to ask.
No one's tried yet.
I know. I was like, I don't know. Maybe you probably could. So she was talking about how, when people went to buy condoms, it was so humiliating because you were trying to do the right thing, but then like everyone in your neighborhood could see you buying condoms, and it was basically a suppressant. It was like preventing you from actually getting the condoms because it was so, you felt so exposed. Now the condom aisle in Target is like 20 feet long and 6 feet high. I mean, I've never seen so many condoms in my life. It's fascinating. So that has definitely changed, but other forms of contraception have also changed. Let's start with the pill and how it's evolved.
Yeah. So the pill is just a form of hormone that has been formulated for people to take by mouth as a pill. We call it oral hormonal contraception or hormonal contraception. There's a hormonal contraception, sort of a bigger bucket, because you're about to hear there are other ways that we can shift and change hormone levels in order to prevent pregnancy. But the very first way was through this oral pill. And oral contraceptive pills often use either one or a combination of two hormones. It will surprise you zero that these are the same hormones that are involved in menstrual cycling. They are estrogen and progesterone, and there are different doses and different schedules. And there's a whole world of the sort of titration of the right dose of oral contraception for good reason. Bodies respond really differently to each of these pills. Vanessa, when you and I were growing up, the offerings were more limited. The doses tended to be a little bit higher. The sources of these hormones were different. And so I remember very, very vividly in high school, people talking openly about mood changes they had with these medications. Their breasts would swell tremendously, weight gain. Today, there are so many different doses and combinations available that most gynecologists who prescribe them, pediatricians also prescribe them, family practice doctors and some internists will also prescribe them. But most of these doctors are able to find a dose that doesn't have any of those side effects, which is really quite incredible.
Yeah. And the laws have evolved dramatically, right? So originally only married women could get a prescription for the pill.
How crazy is that?
And, later, as Cara said, things not only did the pill itself evolve, but our social awareness of it did, our willingness to talk about it, that it wasn't secretive, and it got covered by insurance. Although we'll see what happens with that. And Cara, I believe that there's over-the-counter
Yes.
pills. Can you talk about that for a second?
Yeah. I mean, this is a huge shift, right? Only in the last couple of years have people been able to buy oral contraceptives over the counter. Now, I will say my medical training made me very afraid of this option, right? Because putting hormones in your body is not without risk. And there are lots of things that people need to know that they don't necessarily know. For instance, if you smoke cigarettes while taking oral contraceptives or having any hormones actually coming into your body, there's an increased risk for some people of blood clots. Why is that important? Because those clots can move into your lungs and they can make you extraordinarily sick. They can even be fatal. Another one, if you're on one set of medicines or another medicine that changes the way you metabolize drugs, usually it's in your liver, and you add a hormone, you might metabolize that hormone differently, especially if you take it orally. So you might think you're taking one dose, but your body might be seeing effectively another dose. So like in a perfect world, would a doctor prescribe everything? Yes. Also in a perfect world, would the doctor have lots of time to explain everything to you and walk you through all the pros and cons? Yes. But since we know that the world is not perfect, access to care is not equal, doctors have no time, it makes perfect sense to me that these pills are available over the counter. There are lots of other ways you can get hormone into your body, and people do. And I want to go through those ways really quickly because some of them are more popular, frankly, than oral contraceptives. So the most popular form of contraception at this point is an IUD. And we're going to talk about IUDs in a minute, but I just want to introduce the concept by saying this is a device, intrauterine device. It's a device that gets inserted into the uterus. And some types of IUDs are coated with hormone. And that hormone on the IUD provides an extra layer of pregnancy prevention. Not all of them are hormone coated. Other ways that we get hormone into our body, you can do a shot. The most common one is known as Depo-Provera. You can have an implant, and these implants, they are these teeny tiny, I think they're usually made of glass or some sort of synthetic material that's glass-like. They're like teeny tiny styluses, like the inside of a pen, but shrunk down. And inside them is hormone, and that hormone gets released in a very slow and regular way so that it's essentially like taking a pill daily, but you get to leave these in for usually it's about 3 years. You have these vials in you. And usually they're implanted into the upper arm. There are patches. I mean, anyone who's in menopause has heard about hormone patches, estrogen patches, and you can get hormone in your body that way very effectively. And then there are rings. And rings they think of, and we'll talk about a diaphragm in a second, but if you remember from, sex ed from way back when, it's the round part of a diaphragm. It's like literally like a washer ring, but it's made of a flexible material and it gets folded and inserted into the vagina, and it is coated with hormone and releases the hormone locally.
Right. So IUD that has hormones, the hormone is released locally. Same with the ring. Oral contraceptives and the implant, it's released systemically. So it operates throughout the body.
And the shot and the patch, yeah.
And the shot and the patch.
Yeah.
So, Cara, an obvious question for people who've listened to our episode with Avram Blooming and Estrogen Matters and the relationship between hormonal therapy and cancer. What is the current understanding of the use of hormonal contraception in someone whose family has a history of breast cancer, ovarian cancer, uterine cancer?
The answer is entirely personal, depending upon your own personal history and your own medical needs. But most doctors that I know will point to non-hormonal alternatives like an IUD that is not hormone coded. And that is, I think that is now the most common. I mean, I know IUDs are the most common. A copper IUD. So I know IUDs as a form of contraception are certainly the most common among the teenagers, 20-somethings into the mid-30s. IUDs are by far the most common. And I believe copper, which is not hormone coded, has now outpaced hormone coded, although I could be wrong. So if you know something otherwise, please let us know. But most people would say, if you can steer clear of hormonal contraception, why wouldn't you if you have that family history? I will add that there's a really interesting body of information that is evolving around perimenopause and hormone therapy there. And there's this question of, can you use oral contraceptive to essentially transition you through perimenopause so that you don't have a lot of the symptoms? And the answer, to the best of my knowledge, based on everything I've read, the answer is you can, and some people do, but it's not recommended. Like, the dosing of oral contraceptive pills is different than the dosing of hormones that are designed to help someone through perimenopause. So there are certainly lots of people who will say, I had a hormone-coded IUD, or I was on the pill and I never had any symptoms during perimenopause. And I think that's why. And most researchers and doctors would say that's totally possible. But the way that you approach using these hormones for the two situations, pregnancy prevention and menopause, are totally different.
Yeah. I mean, I would imagine in the not too distant future that there will be oral hormonal medication specifically for that. It's not repurposed hormonal contraception, that there will be oral, and maybe it exists, but I only hear about people using traditional hormonal contraception to manage perimenopause.
Right.
I haven't heard of hormonal therapy taken orally to manage perimenopause symptoms.
That's right. And it's because it's generally not a thing. I mean, it can be, anything's a thing, but it's not a thing. I want to do a minute on IUDs just to be super clear, because these are so popular. And then to talk about sterilization as we round out the conversation.
Is that the term that people still use?
I mean, no, I don't like that term, but it is what it is. And so,
it has such like,
it's like major ick factor, that term. But let's just talk about copper coated IUDs for a second, because I just want people to understand how they work. Because if you have a daughter in particular who is looking to use a contraceptive device, they will be researching IUDs. I mean, I'm just telling you, they will. So here's how they work. They're shaped like a T, and they get inserted into the uterus. And the uterus, remember, is sort of like narrow at the bottom and wider at the top. It looks kind of like a pear turned upside down. And the inside is hollow. And then there's a really thick muscle. And so inserted into that hollow inside is this T-shaped device. And it
through the cervix.
Through the cervix. Thank you. Through the cervix. And it does a couple of things. The first thing it does is it physically obstructs implantation. So like, it literally gets in the way of a fertilized egg implanting. So if you have a hormone-coated IUD, the hormone will make the lining of the uterus thinner and not that
less hospitable.
That's the word I was looking for. It's less hospitable. If you have a copper IUD, the copper does not thin the lining. it actually causes inflammation. And that inflammation makes the uterine lining less hospitable.
And if you have someone in your life who's thinking about doing this and you go with them to their doctor's appointment to discuss it or not, there's some really important things to know about what happens when you get an IUD. So first of all, as someone who has had 2 different IUDs implanted in her body, it doesn't feel so great. And recently it has been approved to give a sort of a numbing injection before the IUD is implanted to deal with some of that pain. And what's so interesting, I find this so interesting. These are the things you talk about when you go to a women's college. So my friends and I in college talked about what it was like getting a pap smear. And for some people, their physical reaction to a pap smear, to having a speculum, to having their cervix swabbed is so extreme and so uncomfortable, and they are in excruciating pain or they vomit, right? There's really differing experiences. Whereas I was kind of like, all right, this is now, oh, that speculum was kind of cold. Thank you so much for taking it out. The same is true when a woman is considering getting an IUD. They should know what the experience of having it put in is like. They should know what it's going to feel like after it's put in and the days following, right? There might be cramping or spotting. And then what the experience of their menstruation is going to be after getting an IUD. I will tell you, and this is so TMI, but like, I view this as a public service.
But this is a women's college.
But
so
this
go.
is just pretend we're all at Wellesley for the next 5 minutes. When I had a copper IUD for the first year and a half, every time I got my period, it was like a homicide scene. I mean, there was so much blood and I wasn't prepared. Now, after the year and a half, it was great. It was totally awesome. And I did by 10. It was actually 11 years because it was COVID. And as an afterthought, when I spoke to my gynecologist about replacing my IUD and I was just going to get the copper IUD, I said to her, wait a second, will that happen all over again? And she said, probably. And I said, I don't want to go through that again. I'm going to get the Mirena. I'm going to get the hormone coated IUD because I cannot deal with that year and a half. Now, I was a 45-year-old woman who'd had given birth to 4 children. I was very comfortable asking all sorts of questions about what was going on in my vagina and my uterus and all that. Think about an 18-year-old asking those questions. So part of the contraception conversation is actually about what are the questions we want to help kids think about they should be asking. And they're not always going to come to us and say, hey, I'm thinking about getting an IUD. Can you prep me for the meeting? We might not even know that they're going to get an IUD.
You know what else they're not going to come to you and say? Have you heard about the TikTok? It's not really a TikTok trend. It's not like people are trying to do it, but the series of TikToks that went around showing people pulling out their IUDs on their own. And this is a hugely important PSA because IUDs should be inserted by and removed by people who are trained to do this. They do not come out on their own. They are not designed to be pulled out on their own. And yet, Vanessa, so much information on social media. And so these are the questions kids have. And your face says it all, which is, we need to know about this and we need to be able to myth bust for them and to be able to have real conversations and let them know, no, these things you're seeing, this is not how it's supposed to be. Or this is not, by the way, there's a string, I'm using air quotes, on the end of the IUD that comes through the cervix. That's the way that the healthcare provider can pull it out. They grab onto the string. That's sort of the topic on these TikToks. And the string is not made of string. It's made of wire. So that's just a fun fact. Let's land on surgery.
Wait, we didn't really talk about diaphragms because they're not such a thing anymore.
My gosh.
I mean, they still make them, but
go. We're still at Wellesley.
Yeah, I mean, diaphragms as a child of the 70s and 80s were the first form of contraception I heard about, but they're not really a thing. I mean, part of the reason IUDs are so popular, part of the reason people like the shot or the implant is because it's sort of like put it in and forget about it. Like you don't have to worry about with pill, you have to take it at the same time every day. With a diaphragm, you have to like prep it, put it in, put in the spermicide. It has to be in for a certain amount of time before you actually have sex. Then you got to take it out. Then you got to wash it. It's like a whole production,
which we have outlined in great detail in the book because no one knows about any of this stuff. So read it.
I need to listen to you reading that part on the Audible book. I need to listen to you reading that part.
You really don't, actually. You'll be like asleep in 2 minutes. Okay.
So diaphragms are still around, but they're just much less popular for all of the reasons that we just outlined. And then, Cara, there is the word, I really don't, what is the alternative word to sterilization?
Well, surgery. I mean, it's surgery. And remember the little at the top, that visual of the egg is coming through the fallopian tube on one side and the sperm is going through the fallopian tube on the other side. If one were to cut the fallopian tube and sew the cut ends closed so that the egg cannot get through on its side and the sperm cannot get through on its side, you prevent fertilization.
Right. The colloquial term is getting your tubes tied.
Right. Tubal ligation is what we call it in medicine, but getting your tubes tied is really what everyone calls it. And then vasectomy is the male version of this. And what that is the cutting of the vas deferens, which is the tube that carries sperm from the testicle up and out towards the end of the penis.
And what's so cool that you learn when you either go to medical school or you teach kids about sex and internal reproductive anatomy is how similar the architecture is.
That's amazing.
So the ovaries are the equivalent to the testicles. Mm-hmm. The vas deferens are the equivalent to the fallopian tubes. I mean, there's some very cool, we have some diagrams in our curriculum and also in our lessons in Less Awkward University. And one of the things that is so cool is when you look at a frontal version of the internal reproductive organs of females compared to males, a frontal, not a side, because everybody's so busy showing the penis. But if you look at the frontal, it's like they're so parallel. And it's so cool to see, which makes sense. And everyone thinks, oh, there's so much to talk about with females. But if you listen to our episode on male reproductive organs, I think we call it penises and testicles, which is like a fairly straightforward branding. You can hear all about how similar they actually are. Go ahead.
Let's just summarize. Let's give people some bullets.
Yes.
Because it's a lot of information. Okay, correct. Ready? So point one, there is one way to guarantee that you will neither get pregnant nor have an STI or STD exchanged. And that way is not having sex, called abstinence. There is a second way to significantly reduce the risk of pregnancy and the passage of STIs or STDs. And that is to use a barrier method when you're having sex. And that barrier is called a condom. Everything else that falls into the category of contraception is pregnancy prevention, but it is not STI or STD prevention. It is every other mechanism just stops an egg and a sperm from meeting in the first place or prevents a fertilized egg from implanting in a uterus. And that's really the big take-home message. To those who are wondering, is there male contraception coming beyond condoms? That's an evergreen question. The answer is yes. There are a lot of startups that are starting to look at oral medications that males can take. And also there are some physical things, some foams and gels that are now being tested. So I think male contraception is going to, or male pregnancy prevention is going to shift a lot. We know that the types of contraception that existed, Vanessa, back in the olden days when you and I were growing up, the pill, IUDs, these things have really changed a lot. IUDs, when I was in high school were associated with so many complications.
Mhm.
Today, they are not. And this is a constantly evolving field. However, right alongside with the scientific shifts and the medical shifts and the new data, we have butting up against that new laws and rules that are emerging in our society that are changing the way people can get information. And this is where, we don't like to get preachy, so I'm just going to make a plea. I'm going to make a plea that you make sure that the people in your life, adults who are looking for more education and kids who are hungry for it and need it, that they can get accurate information. However you can make that happen. Maybe that means collecting the information on your own and passing around as books. Maybe that means joining some of these campaigns that are emerging online in order to try to get a lot of these websites that have recently been taken down put back up. You do you figure out where your voice is, but please, please, please make sure you educate yourself and you educate the people around you, because what we know is that education is empowerment. We know that. And taking the information down or taking the information away doesn't help people. It only harms people.
Thanks, Cara.
Thanks, Vanessa.
Thank you so much for listening. You can email us with questions, feedback, or episode requests at podcast@lessawkward.com.
If you want to learn more about what we do to make this whole stage of life less awkward for everyone involved, our parent membership, our school health ed curriculum, our keynote talks, and more are all at lessawkward.com.
And if you want products that make puberty so much more comfortable, visit myumla.com.